Hi there, I'm Dr. Ofreya Mankwa, the Director of Medical Services at Focus Orthopedic Hospital. In preparing for surgery, a patient has to undergo quite a number of tests. And these tests are all done in order to ensure that the patient is physically as well as hemodynamically fit to undergo the stress surgery imposes on the body. Some of these stresses come in the forms of blood loss during surgery, through anesthesia, and also in the metabolic changes that take place when a wound is attempting to heal. And so it is essential that the patient is stable enough to undergo all these. The tests also help us to identify illnesses which the patient may have. Sometimes a patient may not know that he has an illness or a disease, and these tests help us to establish that. Here at Focus we have what we term as the Focus score, which uses such parameters as the pulmonary function test, the BMI, among others. And so carrying out a pulmonary function test in this patient, for example, will help us to know how stable the pulmonary reserves of the patient are to be able to withstand the stress of surgery vis-a-vis the type of patient population that we are faced with, patients with scoliosis, chest wall deformities and the like. So in a nutshell, carrying out tests before surgery is a crucial part of what we do, and it only goes to enhance the well-being as well as the outcome of the surgeries that we perform here. It entails looking at what health challenges a patient might have, looking at his current state of health, and also seeing how that translates into his being declared fit for surgery. It might be a deformity, it may be a chronic condition the patient has, it may be some other medication or comorbidity the patient carries. In order to ensure that the patient is indeed fit for surgery and to ensure a good surgical outcome, it is important that these are all optimized, and that's the medical term we use, where parameters are controlled, hypertension is controlled, diabetes is controlled. The type of patient who undergoes a surgery could also determine the outcome. The health of a patient does affect the surgical outcome. I could say that good healing or good health influences the good healing and early recovery. It also ensures a smooth rehabilitation of the patient and also helps to avoid complications.